I'm Dr. Ben Newman. I'm a coronavirus researcher, and let's answer your questions. The next question is from BA. Yeah, hi BA. Let's see. Okay, so the question is referring to a Facebook video. I've asked Nicola to go back and look at the video because I'm not actually on my own Facebook site. She's running that thing, and they've locked me out of my account. So like ages ago because I didn't want to give them my driver's license. Yeah, and I wasn't on it for long enough that they just decided I don't really exist. So anyway, and yeah, they don't have any complaints department or anything. So it's Facebook, whatever. You get what you pay for, I guess. Yeah. So I can't see the video, and if it turns out that I'm responding to the wrong thing, then I'm going to re-record this video for sure. But for now, let's try this. So I think I know what you're talking about, and yeah, let's see. Let's see if we got it right. Okay, so could you ask Dr. Ben to update this and see if he has an opinion, or if his opinion is the same, or if it's updated by new research. It's always updated by new research because, oh my gosh, is there stuff coming out all the time. I had 2 papers sent to me yesterday that I had not seen before that are really interesting. I've got 2 more that are open on my desktop that I got to read today, and yeah, that's fine. That's how we learn. Yeah, so it's a fast-moving stone, no moss whatsoever. All right, so especially regarding the immunity issue. All right, fine. And so I'm guessing this is either going to be herd immunity or how long immunity lasts and what it actually is. And so I'm gonna try and address the broad question because I haven't seen the video and I don't remember what it is. Yeah. All right. People will often say immunity, like saying you're young, therefore you'll be immune or something like that. And that's just kind of a sloppy way of saying it. What they're saying is you're young and you don't have as many risk factors, but immunity is something you can only get after you've had the virus and then got over it, which the rest of the question, yeah, BA understands this. Yeah, this is built into the question, but this is something that I've seen people on the outside, yeah, just, it's like a term they use, but it doesn't mean quite what they think it means. Yeah, so that's fine. Or it doesn't mean what it means to a specialist. Maybe that's a better way to say it. Let's see. Seems like there are more people I know, even a neighbor, I'm assuming, that got SARS-CoV-2. Yeah. Which is bad, and I've felt like that at times. Like it's just closing in, like it's one person away, and then it's like behind you, and then there's someone, the phone call's coming from upstairs. Yeah, that kind of thing. And yeah, it's been a little worrying, a little traumatic, but we've made it through so far. Yeah. Okay. And so about this neighbor, the whole family got it, and the health department only had them stay in for 24 hours past fever. That's really bad advice. Let's put that out there. I know there are health departments that are saying this, and they're going by timing. They're saying, okay, once you've had the disease for this long, you're probably going to be okay. And yeah, their timings are based on averages, based on what we thought we knew back in March, maybe. And so everything is completely messed up, and they are sending a lot of people back out when they are definitely still sick and potentially capable of spreading the virus. And yeah, no competent health department would do that. So we're talking about either garden variety incompetence, where they just don't know what they're doing. They don't know that the guidance has changed considerably which the guidance for polio or something has not changed considerably since March. The guidance for what to do with smallpox really hasn't changed since then. For Ebola, about the same as in March. It's just the guidance for this particular disease, because the whole world, the whole scientific community has been focused on it. We've got a lot better idea of what does and doesn't work, and yeah, this is very much in the doesn't work category. So either just regular incompetent, just in that they don't know everything in the field, where they're issuing advice that could get people killed, or the other option is sort of a willful incompetence, where they're trying to do a thing, where they think somebody's going to be happy if we get people back to work, even when they're maybe a little bit still infectious. But yeah, they're trying to maybe balance risk and reward. But in a way where the mathematics just don't work out. It's basically yeah, bad arithmetic. So those are our choices here. I don't really like either one. Yeah. So I don't know what I said, but I feel like this is probably pretty close to what I said back then. So you can watch. You have access, so you can tell me if it was. And I'm getting Nicola to watch that one back and let me know what the heck it was about. So the rest, more schools are staying open. Yeah, but some schools are closing, and the cases are spiking everywhere, and it's horrendous. This is one of those cases where there is no way we would keep schools open if it was anything other than this weirdly politicized crazy town virus. We close our schools on the threat of snow in some places. The worry that somebody in their car might, skid a little bit and get into a fender bender and, yeah, might be late to school and damage their precious car. We cancel school for that stuff. We cancel school if it might be a little too cold and the kids might have to wear, a coat and gloves in school. And I'm okay with those things, by the way. I'm not meaning to say, we should never cancel school for anything. But then put it into context, we've got this virus that has killed children, does kill children, kills more adults, yay, but, yeah. It's still really bad and very serious, and it causes long-term damage in the brain, and it causes long-term damage in the heart and in the blood vessels, and we're okay leaving schools open with this. And that does not square with everything else that I understand about school and its purpose. It sounds a whole lot like trying to carry on through the Blitz, like trying to, put a brave face on a bad thing and just grimly go out there and do it. But in a situation where we don't have to do that, where we're just, we're doing things that hurt people and there's not really any reward for it, any larger reward. Yeah. So you can still learn remotely if the money is in place to be able to get like little hotspots and Chromebooks or something out to people. And there are ways to do this in most places, not every place, but most places. So, most schools that are staying open because of, I think, political ideology, not because of, totally in defiance of reason, science, compassion, good sense, and, morality and human decency. We can throw those in there as well. Yeah. Which, again, I suspect is probably roughly in line, but maybe a little harsher than what I would have said before. But I didn't expect people would keep making the same dumb mistakes. I expected us to learn, move on, and there'll be mistakes. But, a mistake is when you don't know what's going to happen after you do a thing. And when you know real well what's going to happen and you do the thing anyway, then I think it becomes much less excusable. Okay, more cases are rising again, entire families. This is from the question. But it doesn't seem to be so harsh. Yeah, the cases are rising now, but remember, deaths trail about 1 month behind a rise in cases. So 1 month ago, we were just barely starting to rise. And now you can see the deaths just barely starting to rise. It's the same curve, it's just shifted a month later. So awful as it is to say, terrible things are coming, and about a month from now, our deaths will have caught up with the very bad situation that we're in. And the situation is not yet showing any signs of slowing down, at least in the US and Western Europe and, the world. There will be a toll to pay, unfortunately. And the people that are going to die are, in large part, already sick right now. Some of them don't know it yet. But, basically, they are going to be statistics. And that is really sad and really bad. I don't like it. Yeah. Anyway, yeah. And I don't know if I said anything like that, but it feels like something that I might have said. Yeah. Okay, anyway, in a family I know, the healthiest person is one who has had the roughest time. Right, this thing is unpredictable. Totally with you there. Yeah. And even when we get it repeat, like second time around, it seems to be unpredictable. Sometimes worse, sometimes not as bad, sometimes just about as bad. It's just the disease. It's like the first time, because you can only really catch it once your immunity has gone down to a certain point. Now you're saying these people are told they're immune for the next 3 to 6 months. That's the thing. Yeah. There's no test that actually can tell you for sure whether or not you are immune to SARS-CoV-2. They can look and see, do you have some things that people who are probably immune would probably have? If that sounds real indirect and like a whole lot of hedging, it's because that is literally as close as we can get to the actual answer to that question. So there is nobody, even a day after SARS-CoV-2, that can guarantee they can't get it the next day. Yeah, probably there's going to be some immunity on average in most people, but not in everybody. There have been cases where people have recovered from the virus and you can barely find any trace of an immune response in their body. It's like the virus, tied its own shoelaces together, tripped over, fell, and yeah, the body just happened to be still standing at the time. Those people almost certainly can get the virus again, like right away. Yeah. And eventually we'll be able to read about this in some journal, and some poor bugger is going to be dealing with the misery of going through it a second time. Yeah. So, there we go. Yeah. So, I don't know if this has anything to do with what we said in the last video, but these are at least my updated thoughts, and yeah, I'll bet they're pretty similar to what we thought before. It's just we were thinking that before based on less data, and now we got more data, and it's very much more the case. Yeah, and there'll be more data after this, and we'll look at it, critically assess it. Yeah, and I'll put another one of these up. There's a paper with a little sliver of good news for long-term immunity. I'll do that one next. But for now, yeah, that's where we are. That's what we understand, and that's the best we can do. So yeah, I would still say stay the heck away from COVID. There's nothing good that can come out of it, and even the immunity, if it exists at all, is going to be pretty short-term and absolutely not worth the price of going through the disease. That would be that's my advice. All right. Thanks very much. This has been Ask Dr. Ben.